This is Group 2's presentation on macro trends effect on healthcare careers by Michelle, Alice, Charlene, and Jaya. As the healthcare world continuously expands, there will be a multitude of career openings by the year 2020. These careers include careers in cybersecurity, health information technology, careers with Epic Systems Corporation, consulting firms, and healthcare quality assurance. With most healthcare institutions becoming more and more involved with online patient record systems, blooming technology, and the prevalence of smartphones, patient information is at risk of being leaked. Jobs in cybersecurity will be much needed in the future of healthcare in order to protect this valuable patient information. The annual cost of healthcare fraud was between $75 billion and $250 billion in the year 2009. In the past few years, there have been many data breaches at universities and even department stores such as Target. If hackers can access this information so quickly and easily, what will stop them from targeting healthcare systems? HIPAA rules provide a framework for securing private health information, but the regulations are fairly hands-off in terms of the specific technologies and policies used to achieve compliance. The tightening of security procedures includes the following: authentication by managing user IDs and passwords, configuration by not using default settings as they are as open as possible, patch management, and the proper education and training of end users. Electronic health records are becoming more prevalent in medical institutions as part of meaningful use requirements. With the growing amount of electronic health records in hospitals, there is an increasing need for health information technology assistants. These jobs can be anywhere from entry-level to high-level. Approximately 272,286 people will be electronic health record technicians by the year 2022, compared with 186,300 2 years ago, according to the Bureau of Labor Statistics. Going along with electronic health records and cybersecurity, Epic is the most widely used electronic health record in the world. Epic's applications support different aspects of patient care tailored for each department, such as ASAP, which is used for the emergency department, and Beacon, which is used for the oncology department. The company had revenue of $1.5 billion this year, up from $1.2 billion in 2011 and $47 million in 2000. It employs about 6,800 people, and its workforce has more than tripled since the year 2005. In the past 8 years, on average, Epic has hired more than 2 people every weekday. This company is booming and will continue to grow as the need for electronic health records in hospitals increases. The growth of Epic has produced hundreds of consulting firms that help hospitals and healthcare providers install and operate Epic electronic medical record systems. Consulting firms recruit experts who are available for hire for either short-term or long-term assignments in order to evaluate practice or complete an assessment of something such as Epic. The demand for these consultants is continuously growing and is currently at an all-time high. These consultants need to be able to manage systems such as Epic once the system is up and running at a medical institution. This includes optimizing software to be harmonious with the hospital's preferred workflows and educating super users and end users to be proficient in using the system before and after the go-lives. There will always be a need for quality assurance in a healthcare setting. Careers in this field are important because they audit processes by prescribers and providers to assure that patients are receiving the safest and top quality care that they can receive. The information technology side of this deals with testing the quality of different types of software before they are used in a hospital setting. As technology increases day by day, there is a greater need for quality assurance managers in order to provide the best products to hospitals that ensure patient safety. With the amount of money that is spent each year, we need to get a grip on how to make the necessary changes to use that money correctly. There are many systems that are being implemented and looked at that can be used, but it will take some time to get some traction. One of the most recognizable is, of course, trying to eliminate the old antiquated system of fee-for-service. Because the aging population is going to continue to grow, this will continue to put a strain on the entire healthcare system, especially if we do not start to make the necessary changes now. The Medicare and Social Security systems will and are going to take the hit. This next section of our presentation deals with the personal lifestyles and behaviors of patients. Obesity is not always a choice, but the way in which many Americans live is contributing to this new epidemic and creating uncertainties in how the healthcare industry will successfully handle future obesity problems. Diseases such as diabetes and hypertension are results of obesity, and the increase in patients with these illnesses will put a tremendous strain on the healthcare system in the future. The idea that smokers can still get the nicotine fix they crave without the carcinogens is appealing. However, not much is known about the long-term effects on e-cigarette usage. The uncertainty of exactly how future healthcare costs are unknown. Biotechnology is a field of technology that applies technology to biological sciences. Nanobiotechnology applies this technology on the nanoscale. In some cases, nanorobots can complete processes and procedures less invasively. The ability to seek healthcare over a phone, via chats, texts, and video calls will allow patients the benefit of care without having to leave their homes. Mobile telehealth is an exciting new opportunity to advance how the industry administers and consumes healthcare as well. The country is split on the Affordable Health Care Act, but for the first time, many Americans who have never had health care in the past now have a strong health care plan.